Good morning, Saunders County and beyond. It's April 24th, and I am Dr. Hank Newburn from Saunders Medical Center here in Wahoo, here to give you an update on what's been going on in our area as far as the coronavirus and COVID-19 illness. So far, we have not seen a large surge of COVID-19 patients, and I think that's a testament to the outstanding job that our community is doing in regards to those measures to help control the spread of the virus. People that are doing the social distancing, you're washing your hands, you're only making necessary trips to the grocery store to get gas, to come to doctor visits. All those things are paying off because we're not seeing an overwhelming surge coming through the hospital at this time. There are some predictions that in the next couple of weeks that may happen. So we need to continue to adhere to those control measures that you've all been doing such a great job practicing. However, I am very optimistic that we are going to be able to meet everybody's needs in this dire situation. And again, it's all because of the wonderful job everybody's been doing in following those control measures. Now, as far as what's going on here at Saunders Medical Center, many of you that have been through the clinic, you'll notice that when you come through our front doors, you're going to be met by one of our wonderful employees. They're going to ask you some questions, they're going to take your temperature, and they're going to triage you as to where you're headed, and they're going to give you a mask. Some of those masks are surgical masks, especially if you're sick. But some of them that are not sick, you're going to get a mask that's a cloth mask that has been made and donated to us by people in the community. So we take this opportunity just to thank you. And if you receive one of those masks, just realize that somebody in this community provided that to us to care for you and to help support our mission. So be thankful. Again, if you've visited the clinic, you know we have a side that is for sick individuals, and then we have a side that's for the well individuals, so we can keep y'all separated and minimize the spread of illness as much as possible. So you can take that into account. If you need to be seen for a non-infection related problem, we are open to see you. We are here. Everybody still has those ongoing health problems and other acute illnesses that need to be managed. What we do ask is, we've been kind of hammering into everybody since this all started, is call us first. We can help triage you. We can determine what your needs are and what would be the best way to receive you into our facility so that we can minimize your risk and minimize everybody else's risk of any potential illness. But we are certainly here for you for all those other healthcare needs, and give us a call first. Now, there is some good news on the horizon. Because things have been going fairly stable, we're not overwhelmed by COVID-19 illness. About May 4th, we may start doing some elective surgeries again, things like colonoscopies, hernia repairs. So that's some good news that we may be seeing some lightening of the restrictions that have been put upon us because of the COVID-19 illness. Some other things I'd like to address are testing. As I've explained in previous videos, we get our direction as far as who to test from the state health department, which they receive information from the Centers for Disease Control and the federal government. And then we also get information from our local health department, Three Rivers. Because we've done such a good job of flattening that curve, we've had some opportunity to build up some resources and to increase our ability to test. And we know that it's well spread within our community, although there's just not a lot of devastating illnesses at this time. Because of that, we are able to and have been cleared to go ahead and test more frequently. Now, we're not just going to test anybody who wants to. If you seem ill with a cough, sore throat, fever, short of breath, there's still lots of the common viruses out there, but we can go ahead and test you for COVID-19 and receive a result in about 2 to 4 days, which is a lot better. A couple of weeks ago, it was 7 to 10 days before we get a result. So with that increased capacity for testing, shorter turnaround time, and we can start to test more frequently now. Now, we at Saunders Medical Center are not going to be doing any of the rapid blood tests. The reason for that is they are not very accurate. They do have the potential for a lot of false positives, and that gives us false information. We want the most accurate information available so that we can educate you and that you can then run or attend to your life more appropriately with that information we give you. So you're not going to see blood tests from us. We will be doing the nasal swab, which is much more effective, or at least much more accurate in determining whether or not you have COVID-19, coronavirus. That's pretty much it as far as what's been going on as far as coronavirus and COVID-19. Things have slowed down quite a bit. Back when this all started, about every day it was changing. All the information we're trying to get out to you and it was being given to us, every day it was changing, and it was kind of a rocky road. You never knew what the day was going to bring. But now for the last couple of weeks, things have been pretty smooth. We've had time to adjust. We've had a lot of time to prepare. And I hope we don't see a surge. And I'm optimistic because you all have been doing such a fabulous job at following those measures to help prevent the spread. Keep it up. Keep up the good work. It's going to be easier to do now, I think, because the sun is out. That certainly helps. Good weather helps. It helps improve our mood. You can get outside and walk, do a little exercise, but continue to maintain your social distance and stay away from sick people, wash your hands, all those things. So keep up the good work. We will, here at Saunders Medical Center, continue to try to get out some videos to you especially when there's a dramatic change. There really isn't any dramatic changes going on right now. We are going to increase testing. There's the potential for increasing or going back to doing some elective surgeries May 4th, so that we can expand some of our services to you to continue to care for you as best we can, because that is our mission. Our mission is to help support the health of the Saunders County community and make sure that you live the life you want to live. So with that, take care, enjoy the weekend, and may God bless you all.